Hi, my name's Dr. Tyler Elmore. I am the clinic director here at Elevated Health. And we've had a lot of questions lately about one of our services, which are ketamine infusions. And we just wanted to do a little impromptu video and tell you a little bit about what they are, how it works when you come into the clinic. And we've got Michelle, who is going to talk a little bit about her experience doing ketamine infusions here. So one of the things with ketamine is it is becoming a big alternative or another option for depression. We get a lot of folks in here that have gone the traditional route with depression, and they've been a little bit frustrated. Maybe have not gotten the results that they wanted, or they're tired of spending 4 or 5 months per medication trying to figure out whether or not it's going to work. And so we've been using ketamine infusions to actually help them with their depression, their anxiety, their chronic pain. There's several different things that it does treat. And so anyhow, I'm going to ask Michelle just to tell you a little bit about her experience when you come into our clinic. Kind of what have you experienced? What's the atmosphere like? Go ahead and tell them what you've done.
Well, first of all, the staff is awesome. They're like super warm and friendly. So when you come in, you're greeted by a staff member. You get your own little suite here. It's a nice, comfy chair. I can even bring my blanket. Everybody's been very kind. Very accommodating, but it's very comfortable, it's very relaxed, it's very safe. So it's been a really good
So the
experience.
infusions don't hurt?
No, they don't. You're here for about 45 minutes to an hour. There's been once or twice that I haven't maybe felt like driving home, so I usually will bring a friend or my mom or somebody. But other than that, no, it's great. They don't hurt. It's been an overall really good experience.
Cool. So yeah, what the ketamine infusions, again, like Michelle said, they generally last about 45 to 60 minutes. You do get your own suite, so there's nobody else in here with you. It's a comfortable, relaxing atmosphere. And again, she mentioned we ask that you bring somebody to drive you home afterwards, because with the ketamine, sometimes you're just you need a little bit of help getting home. But basically what the ketamine does is it helps to grow more neural connections up in that brain so that your body can actually adapt more to kind of the stressors of life. So one of the things that we will explain to patients is when you have a depressed brain, kind of picture it like a bush or a tree in the wintertime, where it's just devoid of leaves and growth, and there's nothing going on up in there. When you administer ketamine, what it starts to do is it creates more connections up into that brain. So now that tree, instead of being like it is in the wintertime in hibernation, it becomes like that tree in the springtime. It starts to sprout more growth, you get more leaves, there's more activity up there. And the beauty with ketamine, as opposed to some of the traditionally prescribed drugs for depression, is that ketamine acts very, very quickly. So as opposed to having to wait 2, 3, 4 months to see whether or not you're going to get results, typically our ketamine patients are going to notice results within the first 2 to 3 visits. That doesn't mean that it's completely gone in 2 to 3 visits, but generally speaking, if we don't see results fairly quickly, ketamine is not a treatment that gets dragged out for a long period of time. It's not like we have to do 10, 15, 20 infusions in order to figure out whether or not this is going to work. And so generally speaking, we get good results with it, quick results with it. And if you have any other questions for us, feel free to give us a call at 801-774-7541. Other than that, hope that helped answer some questions, and have a good day.